Hi everyone, Pharmacist is here, and today we're diving into one of the most fascinating antibiotics out there called Linezolid, also known by brand name Zyvox. This isn't your everyday antibiotic. It's a serious player in the fight against drug-resistant infections, and it actually has a pretty wild backstory. Linezolid was originally researched as a potential antidepressant because it affects neurotransmitters. But researchers soon realized it had incredible antibacterial power and gave it a new mission, a fight against infections that most antibiotics struggle to treat. So how does it work? Well, linezolid targets the 23S portion of the 50S ribosomal subunit in bacteria, blocking the formation of the initiation complex for protein synthesis. In plain English, it prevents bacteria from making proteins, which means they can't grow or multiply. It's like hitting the pause button on the infection, giving your immune system time to clean it up. Linezolid is most commonly used against gram-positive infections, especially MRSA and VRE, or vancomycin-resistant enterococcus. It's also effective in some cases of resistant mycobacteria, nocardia, and even anaerobes. Linezolid has 100% oral bioavailability, so the oral and IV versions are equally effective, which is perfect for transitioning patients from hospital to home. The usual dose is 600 mg every 12 hours with or without food, though eating beforehand can reduce nausea. It comes in tablet, suspension, and IV form, but with great power comes few warnings. Using linezolid longer than 2 weeks increases the risk of bone marrow suppression, particularly thrombocytopenia. Extended use beyond 28 days can also lead to optic and peripheral neuropathy. Linezolid behaves like a monoamine oxidase inhibitor. That means it can interact dangerously with SSRIs, SNRIs, triptans, albuterol, and even pseudoephedrine, increasing the risk of serotonin syndrome or hypertensive crisis. Patients should avoid aged cheeses, red wine, and fermented foods high in tyramine due to risk of hypertensive crisis. Common side effects include headache, nausea, and diarrhea, but always report anything like vision changes, easy bruising, or signs of high blood pressure. Linezolid isn't just a treatment, it's a life-saving tool in modern infectious diseases. Use it wisely and it can make a huge difference. Thanks for watching this educational video, and huge prompts to my colleague Vanessa for helping with this content. Stay healthy and I'll see you next time.